Hello and welcome to the next episode of the cranial nerve series. Today we will be discussing about the third cranial nerve, that is oculomotor nerve. The oculomotor nerve originates from the ventral part of the midbrain and exit the brainstem just caudal to the mammillary body. After exiting from the mammillary body, the third nerve enters the cavernous sinus where it travels from the lateral wall of cavernous sinus to finally enter the orbit. Entering the orbit is through superior orbital fissure, and the nerve then divides into superior division and inferior division. The nerve then divides into superior division and inferior division. The superior division of the oculomotor nerve supplies superior rectus and levator palpebral superioris, while the inferior division provides its nerve supply to inferior rectus, medial rectus and inferior oblique. The inferior division also gets a ciliary ganglion which supplies to sphincter pupillae and ciliary muscle. Let us see the functions of third cranial nerve. We will be testing the function of third cranial nerve, one muscle at each time. Ask the patient to close one eye, close your one eye, and ask the patient to focus on the pen. We will be checking for the function of medial rectus in the left eye. Now ask the patient to close the left eye. We will be checking the function of medial rectus in the right eye. For superior rectus and inferior rectus, ask the patient to keep his both eye open and focus on the pen. With both the eyes, focus on the pen. This is the function of superior rectus. This is the function of inferior rectus. For the function of inferior oblique, ask the patient to close one of his eye. Focus on the pen. This movement in the left eye is caused by the inferior oblique. Ask the patient to close the eye. This movement in the right eye is caused by the inferior oblique. Next muscle supplied by the third nerve is levator palpebral superioris. Demonstration of levator palpebral superioris is very easy. Just ask the patient to elevate his lids. Close the lids once, open it. This function is caused by the levator palpebral superioris. Another muscle that is supplied is sphincter pupillae. The function of third nerve is causing the meiosis. So up till now we have discussed the anatomical course of the third cranial nerve along with its function and various extraocular muscular movements. Now we are going to see what happens when there is complete third cranial nerve palsy. So as the third cranial nerve supplies the levator palpebral superioris, there would be complete ptosis and eyelid will be completely downwards. And when you lift the eyelid, when eyelid is lifted with the hand, you can see first pupil is at the normal side, normal eye pupil, but on the affected side, there would be pupil, unopposed action of superior oblique and lateral rectus. The pupil would be in this position with dilatation. So this is the classical third cranial nerve palsy.
Good morning. Welcome to new video of cranial nerve series. Let's discuss about fourth cranial nerve, that is the trochlear nerve. Here is a transverse section of the brainstem. It shows fourth cranial nerve nucleus. This is the third cranial nerve nucleus. Fourth nerve, namely trochlear, originates from the fourth cranial nerve nucleus, crosses over to the other side, exits the brainstem posteriorly and ascends anteriorly to innervate superior oblique muscle. The trochlear nerve innervates superior oblique muscle. Superior oblique muscle has three functions: depression, abduction and intorsion. The red line here shows the axis of the eye. When the eye gets intorted, the axis also tilts. If right-sided fourth nerve is palsied, these actions are affected. Hence the eye lands up in elevated and extorted position. So the axis of the eye is also tilted in this manner. So here is an affected eye. In this eye, right-sided fourth nerve palsy is seen. The eye is seen in an elevated adducted position. In this, the axis of the eye is externally rotated and as you can see, it is tilted. So, as a mechanism of compensation, the patient tilts his head to the normal side, as we can see in this picture. Here, he is trying to compensate this axis by tilting his head. By doing so, the axis of the normal eye also gets deviated. So The normal eye gets internally rotated to fix this axis and make both axes congruent. In case of bilateral fourth nerve palsy, when the patient is made to look outwards, the outward looking eye drops down due to unopposed action of inferior rectus muscle.
Good morning. We will talk about cranial nerve 6, that is abducens nerve. Abducens nerve originates at pons and ascends through climbus and enters through Doreus canal. After Doreus canal, it enters cavernous sinus and runs along the internal carotid artery. It enters the orbit through supraorbital fissure. In orbit, it supplies lateral rectus muscle. Now we will talk about what happens during the right cranial nerve 6 palsy. In this patient, we will ask the person to look straight forward. सरळ बघा पुढे. While looking forward, in case of right cranial nerve palsy, the right eye will be looking slightly towards medial side, where the left eye will be looking towards forward. In case we ask the patient to look towards right side, उजवीकडे बघा. While looking towards right side, the right eye will be looking forward and the left eye will shift medially. And the person will have horizontal diplopia and strabismus. Now we'll ask the patient to look towards the normal side. डावीकडे बघा. While looking towards the left side, both eyes will shift towards the left side.
Finally, we will summarize all extraocular movements of the eye. We will be checking on the left side first. Left eye, lateral rectus, right eye, medial rectus. Left eye, superior rectus, right eye, inferior oblique. Left eye, inferior rectus, right eye, superior oblique. We will be demonstrating the same on the right side. Right side, lateral rectus, left side, medial rectus. Right side, superior rectus, left side, inferior oblique. Right side, inferior rectus, left side, superior oblique.